Have you ever lost track of a refill date or realized two providers prescribe similar medications? Even the best prescription plans can fall apart if you lose track of your medications or forget what's been prescribed. Most billing errors, refill delays, and even safety problems happen because information isn't organized, not because people are careless. In this module, I'll show you how to manage your prescriptions with confidence. You'll learn how to keep accurate records, schedule refills on time, communicate clearly with your care team, and spot red flags before they cause stress or extra cost. When you understand the administrative side of medication management, you'll gain control over your health and your wallet. All right, for the agenda for this module, keep a centralized medication list, align refills, and avoid running out. Communicate clearly with your providers and pharmacies. Store and dispense of medications safely. Watch for administrative red flags. Create a personal medication management system. Safety tips for travel and emergencies, pro tip roundup, closing, and next step. If you had to share your full medication picture in 30 seconds, could you do it? Where would you keep one master list so every provider sees the same information? So, keep a centralized medication list. A simple, accurate medication list is one of the most powerful tools you can have. It's the foundation for clear communication, insurance accuracy, and safety. What to include? Your list should include medication name, dosage, who prescribed it, what's it for, when and how to take it, date started, and if applicable, date stopped. Also note over-the-counter items like vitamins, supplements, and pain relievers. These can interact with prescriptions, allergies, or reactions to medications, including what happened like rash or dizziness. Where to keep it? Keep your list in a place where you can access it quickly on your phone, inside your wallet, or in your patient portal if available. Bring it to every medical appointment, urgent care visits, or hospital stays. Why it matters. A centralized list can prevent duplicate prescriptions, dangerous drugs interactions, and billing errors. When you change doctors or pharmacies, it ensures continuity of care and consistent insurance billing. Now, here's an example. Karen visited an urgent care clinic while traveling. She showed her up-to-date medication list on her phone. The clinician saw she was already on a drug similar to the one they planned to prescribe, preventing a duplication and unnecessary copay. Keeping an accurate medication list aligns with the Joint Commission safety standards and Medicare's medication reconciliation requirements for all transitions of care. When do most of your refills come due? All at once or scattered? What reminder system would prevent last-minute scrambles or missed dosage? Align refills and avoiding running out. Running out of medication is usually a system problem, not personal failure. Small changes in timing, insurance rules, and pharmacy communication can cause refill gaps. Now, set smart reminders. Use your phone calendar, a free app, or the reminder feature in your pharmacy portal to track refill dates. Set alerts a week before you're due to run out, not the day of. Sync your refills. Ask the pharmacy if they can sync your maintenance medication so all refills are due at the same time each month. This saves extra trips and ensures you don't forget one prescription while picking up another. Auto refill programs. Use wisely. Most pharmacies offer auto refill services, but check these details. If your doctor changed your doses, Confirm the new prescription replaced the old one in the system. Auto refills should only continue if the provider still wants you to take the medication. Review text or email notifications so you don't pick up unneeded refills that could cause waste or charges. And lastly, maintain a small safety supply. If your plan allows, keep a 7 to 10 day cushion for long term medications. This helps you if travel or shipping delays occur with mail order. Now, here's an example. Ben takes blood pressure medication daily. His pharmacy synced all his refills and set up text alerts 5 days before pickup. He hasn't missed a single dosage in a year and avoided a costly ER visit due to missed medications. Do all your providers know about each medication changes? At your next visit, what 3 confirmations will you make to keep everyone in sync? Communicate clearly with providers and pharmacy. Communication is one of the most effective safety tools you can have. It prevents mix ups, duplicate charges, and incorrect refills. What to confirm at every appointment. At every medical or pharmacy visit, confirm which medications you are currently taking and stop using old or discontinued ones. Which pharmacy you use, especially if your provider sends prescriptions electronically. If a new medication might interact with one you're already taking. When multiple providers are involved, for example, a primary doctor and a specialist, always tell each one about any medication changes. Next, keep everyone in sync. Use your pharmacy's portal to message questions or reported side effects. If you switch pharmacies or move to mail order, notify your provider so they can update the records. If you start a new plan year or change insurance, tell your pharmacy right away to prevent claim denials or double billing. Next, ask questions. Never hesitate to ask, what is this medication for? How long should I take it? Is this a new prescription or replacing an old one? Pharmacists and office staff appreciate organized patients. Clear questions leads to faster results. Now, here's an example. Jordan switched health plans mid-year. By confirming his preferred pharmacy and current medications at his next visit, he avoided duplicate fill and a $75 overcharge. Now, did you know HIPAA allows pharmacists and providers to share medication information with each other and with you for treatment and payment purposes? Communication between offices is legally protected and encouraged to ensure accuracy. Where do you store medications now? And is that space cool, dry, or secure? What's your plan for disposing of expired or leftover medications? Store and dispose of medications safely. Proper storage and disposals aren't just about safety, they also affect the effectiveness and compliance with legal rules. Safe storage. Keep medications in cool, dry places away from direct sunlight and humidity. Bathrooms and kitchens are often too warm or damp. Use child-resistant containers or locked boxes if children, teens, or pets are in the home. Store controlled substances like certain painkillers or ADHD medications in a secure location. Locked drawers or cabinets are best. Don't share or reuse. Never share prescriptions with anyone or save leftovers for future use. The drug or doses might not be safe for another person, and sharing is illegal under federal law. Proper disposal. When you finish or stop a medication, 1. Check your pharmacy. Most have a take back bins or mail back envelopes for safe disposal. 2. Use community events. Many police stations and pharmacy participate in DEA take back days twice a year. 3. At home. If no take back options exist, the FDA recommends mixing pills with an unappealing substance like coffee grounds, cat litter in a sealed bag before placing in a household trash. 4. Do not flush medications unless they're on the FDA's flush list. A few narcotics that could be dangerous if ingested accidentally. Now, here's an example. Lucy used to throw expired pain pills in the trash. After learning about the pharmacy disposal program, she safely dropped them off and received a thank you voucher for participating. What's the first sign you'll notice when something's off? A price jump, a denial, or duplicate bills? How would you verify and fix it before it becomes a bigger problem? Watch for administrative red flags. Not all medication problems are medical. Many are administrative. Billing, shipping, or authorization errors can cause delay, duplicate charges, or gaps in therapy. Red flag number 1. Refill denied unexpectedly. If your refill is denied, first confirm whether your provider changed the prescription or if the insurance require a renewed authorization. Sometimes it's just a timing issue with annual reapprovals. 2. Charge for a brand drug when a generic exists. If your copay jumps suddenly, ask the pharmacist whether a generic or preferred alternative is available. Plans sometimes change formularies mid-year, and pharmacies may default to what is in stock unless told otherwise. Red flag number 3, duplicate shipping or bills. Receiving the same medication from two different pharmacies. For example, a local or mail order can cause billing conflicts or overpaying. Call both pharmacies and your insurance to consolidate active prescriptions. Red flag number 4, insurance claims not matching receipts. If your EOB explanation of benefits doesn't match your pharmacy receipt, ask for a rebill or clarification. Occasionally, the PBMs, pharmacy benefit managers, apply outdated pricing or tier levels. Red flag number 5, sudden plan year changes. Every January, insurance plan reset deductibles and sometimes move drugs to different price tiers. Review your plan's formulary early and avoid surprise costs. Now, here's an example. James noticed that he was charged $85 for a refill that is usually $10. The pharmacist checked and found the plan had moved his drug from tier 1 to tier 3. By calling his doctor, James switched to another medication in the same class that was fully covered. What single tracking method, app, spreadsheet, notebook would you commit to? Where will you store receipts, EOBs, and assistant paperwork so you can find them in 10 seconds? Create a personal medication management system. Organization keep you in control. A few simple tools make a big difference. First, use a single tracking method. Choose one format, notebook, spreadsheet, or app, and update it regularly. Many patient portals now list all active medications and refill dates, which you can print or export. Next, track refills and costs. Keep a small log of refill dates, copays, and pharmacy names. This helps you catch billing errors and spot sudden cost increases quickly. Store important documents together. Keep all pharmacy receipts, EOBs, and assistance program paperwork in one folder. These records are helpful for taxes and health savings account and flexible spending account claims or disputes. Include family members. If you manage medication for children, elderly patients, or partners, maintain separate lists but store them together. This simplifies emergency care if someone else needs to step in. Now, here's an example. Monique manages her mother's medication. She keeps a spreadsheet that tracks refill dates and copays. When one pharmacy double charged, she had proof of payment and resolved it in one call. If you had to leave home in 1 hour, could you grab your meds and list quickly? Do you have a small backup supply if delays, outages, or travel hiccups occur? Safety tips for travel and emergency. Life doesn't stop for medication schedules. Planning ahead keeps you safe wherever you are. For travel, carry medications in original label containers in your carry on luggage. Bring at least a few extra days of supply in case of delays. If you're flying internationally, carry a doctor's note or prescription summary for customs or border checks. For power outages or disasters, keep a small emergency kit with essentials like blood pressure meds or inhaler. If you evacuate, bring your medication list and pharmacy contact information. Some states allow emergency refill during declared disasters. Ask your pharmacist if this applies. Now, here's an example. During a winter storm, Danielle's power went out for 3 days. Because she kept her medications in a sealed container at room temperature, she had an extra week's supply. She avoided missing any dosages. Now, did you know emergency refill allowances vary by state? Many states authorize temporary refills under state pharmacy emergency rules or public health declarations. Which habit from this list will save you the most stress this month? Updating your med list, syncing refills, or centralizing receipts? What will you set up today so future you has less to manage? Pro tip roundup. Let's summarize the key strategies that make medication management simple and safe. 1. Keep a clear, updated medication list that includes over the counter items. 2. Set phone or calendar reminders and align refill schedules. 3. Communicate changes among all your providers and pharmacies. 4. Store medications correctly and dispose of them safely. 5. Watch for administrative red flags, price jumps, duplicate bills, or denied refills. 6. Keep all receipts and EOBs in one folder for future reference. 7. Plan for travel and emergencies with a small backup supply. When you apply these steps, you don't just stay organized, you prevent many common errors that lead to stress, missed dosages, or unnecessary costs. What's the one system you'll put in place this week? A master med list, a synced refills, or receipts EOBs folder? How would you keep it updated in 60 seconds or less each month? And congratulations, you completed the TJ Healthcare course, Understanding the Prescription System, Managing Medication Coverage and Cost. You learn how to move through the prescription system, choose between brand and generic options, save money, and stay safe and organized for the long run. You're no longer a prescription customer. You're a well-informed healthcare customer managing your health with confidence. What's next? We have a list of courses for you to help you on your healthcare journey. I will see you in the other healthcare courses. Thanks for watching.